Welcome. Today, we're diving into the world of psychology to understand a term you've probably heard before: narcissistic personality disorder. This is more than a simple fascination with oneself. It's a mental health condition that can significantly impact an individual's self-esteem, their sense of identity, and the way they relate to others. It's a complex issue, with many facets to explore. So stick with us as we delve deeper into what makes narcissistic personality disorder what it is. Let's unravel the complexities of this disorder. Firstly, we need to understand what NPD is. Narcissistic personality disorder, commonly known as NPD, is a mental health condition that can deeply impact a person's self-esteem, identity, and relationships. It's marked by an excessive craving for admiration, coupled with a lack of empathy, which can often lead to harmful behaviors. It's more common than you might think, with estimates suggesting it affects anywhere between 0.5% to 5% of the US population. With this understanding, we can now delve into the symptoms and causes. The symptoms of NPD aren't always easy to spot. They can often be mistaken for confidence or strong self-esteem. However, underneath the surface, there's an excessive need for admiration and a noticeable lack of empathy. Individuals with NPD may come across as self-centered, demanding, and insensitive to the feelings or needs of others. They often believe they are superior or unique, and they tend to monopolize conversations, belittle those they perceive as inferior, and insist on having the best of everything. Now, let's delve into the causes of NPD. It's typically a complex interplay of genetic and environmental factors. A person might be genetically predisposed to develop NPD, meaning it can run in families. However, environmental factors like parenting styles and early life experiences also play a significant role. For instance, excessive pampering or conversely excessive criticism during childhood could contribute to the development of NPD. So while the symptoms might be subtle and the causes complex, it's important to remember that NPD is a serious mental health condition. Diagnosing NPD involves a closer look. NPD is diagnosed based on specific criteria. To identify narcissistic personality disorder, professionals turn to the Diagnostic and Statistical Manual of Mental Disorders, more commonly known as the DSM-5. They look for key patterns such as an inflated sense of importance, a deep need for excessive attention and admiration, troubled relationships, and a lack of empathy for others. These patterns must be consistent and across many life circumstances. It's not a simple self-love, but a complex interplay of behaviors and emotions. Once diagnosed, the next step is management and treatment. Treatment for NPD focuses on psychotherapy. Unlike many mental health conditions, there are no specific medications that directly treat narcissistic personality disorder. Instead, the cornerstone of management is psychotherapy. This can help individuals understand the root causes of their behavior, learn healthier coping mechanisms, and begin to rebuild their relationships with others. It's a journey that requires patience and commitment, but with professional guidance, it can lead to significant improvements in quality of life. Prevention is another crucial aspect to consider. Preventing NPD involves early intervention. This means recognizing the signs and seeking professional help as soon as possible. It's about nurturing empathy and understanding in children and creating environments that discourage narcissistic tendencies. The outlook of NPD varies from person to person. NPD, like any disorder, affects individuals differently. The outlook varies significantly from person to person. It hinges greatly on an individual's willingness and commitment towards undergoing treatment. Remember, a proactive approach can often lead to better management of symptoms. Living with NPD is a daily challenge. Living with NPD requires understanding and patience. Navigating life with this condition isn't easy, but it's certainly manageable. Individuals with narcissistic personality disorder and their loved ones must work together to establish firm boundaries, promoting healthy relationships and interactions. Seeking professional help is also crucial. Therapists and counselors can provide effective strategies and coping mechanisms, making everyday life more manageable. Remember, it's not just about dealing with the disorder, but learning to thrive despite it. There are always questions when it comes to understanding disorders like NPD. You may still have questions about NPD. Commonly, people wonder about its impact on relationships. It's true that those with NPD may struggle with interpersonal relationships due to their need for admiration and lack of empathy. Daily life can be challenging, with fluctuating self-esteem and potential conflicts. But remember, everyone's experience with NPD is unique and varies widely. It's important to approach individuals with NPD with understanding. Your understanding and empathy can make a world of difference to someone living with NPD. Understanding NPD helps us build empathy and patience. Remember, narcissistic personality disorder is a mental health condition affecting self-esteem, identity, and relationships. It's characterized by a need for admiration and a lack of empathy. Diagnosis is based on DSM-5 criteria, and while there's no direct medication, psychotherapy is often effective. The disorder may have genetic and environmental factors, and early intervention can help manage symptoms. Living with NPD can be challenging, but with professional help and supportive loved ones, it's manageable. We'd love to hear your thoughts on this topic. Please share your opinions in the comments section below.